afternoon. My name is Deborah Miller. I'm the Director of Health Policy at the Council of State Governments, our national headquarters in Lexington, Kentucky. Thank you very much for joining us today on our policy webinar series. Today's topic is mental health first aid, building safety and reducing stigma. Before we get into the introductions of the folks who are joining us to present the program today, we're going to do a little of the typical housekeeping things. You are in listen-only mode on your phone or computer, however you've tuned in with us today. However, in the GoToMeeting box, you will see that you can type in questions, and we encourage you to ask questions as we're doing the webinar today. We're going to use a little less formal of a format today, try to do it more as an interview. And so we're really interested that you get your questions in, and you can your questions will form part of that interview with our speakers today. So please feel free to use the question box. The audio and the slides will be posted on CSG's Knowledge Center site next week. Perhaps the end of this week we'll get those up, and you'll get notice of that as a registrant for the webinar. We encourage you to share those with your colleagues. That's about it for the housekeeping. So today we're being joined by two staff members from the National Council for Community Behavioral Health Care. It's a Washington, D.C. organization dealing, as its name suggests, with behavioral health issues, mental illness, and substance addictions. Our speakers today are Rebecca Farley. She's the Director of Policy and Advocacy, and as its name suggests, she works both with policymakers to present issues and also with community members out in the states and communities to work on issues related to behavioral health and to have community people contact their elected officials and speak out on those issues. Also, Bryon Gibb, who is the Director of Public Education for the National Council, and he oversees the dissemination of the Mental Health First Aid Program. I'll let him explain to you what that is. He's the lead trainer and trains other trainers. He has a background in mental illness and mental health issues, and is also a former high school teacher. So he's worked with kids in many different capacities. So we're going to go on and get started on this. I thought first, Rebecca, I would ask you to tell us a little about the National Council for Community Behavioral Health Care. I'm not sure it's an organization that our members are necessarily familiar with.
Great. Thank you, Deb. And on behalf of Bryon and myself and the National Council, thank you for having us here with you on this webinar today. We're both really excited to talk about mental health first aid, what the program is, what different states have been doing to promote mental health first aid, and how others can get involved. So the National Council for Behavioral Health is the national association representing community providers of mental health and addiction treatment services to Americans in need. The individuals that our members serve, we have about 2,000 members all around the country in every state. The individuals that our members serve are predominantly low-income or uninsured folks who are living with a mental health or substance use condition, and their families. That's about 8 million children, youth, adults, and families across the nation. We work hard to help our members improve the work that they do with consumers, and we also work hard to be the voice of the community behavioral health safety net here in Washington, D.C. By promoting legislation and regulations and other public policy changes that support the provision of services to people in need of mental health and addiction treatment. We also, under the auspices of the National Council and in partnership with the states of Maryland and Missouri, we run the Mental Health First Aid America, or United States. And I'll let Bryan talk a little bit about that.
Great, thank you. Mental Health First Aid, as many of you may or may not be familiar with the program, is a public education program designed to be accessible by the general public. And it's a lot like first aid, except that it's designed to help individuals recognize some of the signs and symptoms of mental illness, how to reach out and help someone, provide comfort to someone, how to refer them to services if appropriate, or how to de-escalate them if they're in crisis, or get them immediate emergency help. And our program is taught in all 50 states, the District of Columbia, Puerto Rico, and Guam. And we have more than 4,000 instructors across the country teaching the course. Very interactive. It has lots of exercises as well as scenario work, and it has a special kind of mnemonic device that we use to help people remember what to do in what order, but I can talk more about that later.
Okay, thank you very much. I've read a little about your program and understand a little, and I understand that one of the groups that typically receives the mental health first aid training are law enforcement officers. Can you tell us a little more about why that group is a selected group, and perhaps who else you try and reach out to in a community?
Well, certainly law enforcement, public safety staff are one of the audiences that we reach out to. We actually are launching some specific supplementary materials specifically for those audiences this next week, actually. We've been piloting them with various departments around the country, but we're releasing it to our 4,000 instructors next week. Law enforcement and public safety, and I define that by you know, the cop on the street, the cop on the beat, the correction staff, probation and parole, reentry, DA's office, etc. Anyone who comes in contact with an individual who might be in the criminal justice system, those audiences are particularly important to understand our model and to be aware of mental illness and how they can help. Because as you know, individuals in the criminal justice system are more likely to experience a mental illness or a substance use disorder. And so it's especially important for those individuals to have these skills to reach out to the community, but it's also especially important because of the stress of those particular occupations. It's really important for force wellness, for police officers, correction staff, probation and parole staff, etc., to be able to take care of themselves and each other. And mental health first aid helps with that self-care component as well. In addition, you mentioned other audiences. You know, I encourage the listeners to think of really anyone who comes in contact with the general public is a great audience for mental health first aid. But there are some, individuals who work with youth, whether they be teachers, counselors, coaches, youth group leaders, etc., are a particularly important audience. Anyone who works in a clinical setting, and we're talking about individuals all the way down to building maintenance and reception. Oftentimes don't get the same kind of training that, say, clinicians might, but they can really be helpful and an important part of awareness. Especially, it can also help reduce stigma as individuals in those jobs interact with the clientele of those institutions. Beyond that, faith-based organizations, higher education, veterans, anyone who reaches out to veterans. There are lots of different sub-audiences that we work specifically with, but again, anyone who comes in contact with the general public can utilize our model.
Okay, that's very interesting. I know I read on your website that in some state, I don't remember now which state, that libraries, or perhaps it was a city, that librarian staff are being trained in the mental health first aid model.
Yeah, absolutely. Two places where library staff have been trained, and I'm sure many more that I'm not aware of right now, but Travis County, Texas, Austin, Texas, The library system there went through a really kind of a comprehensive training program where they trained all staff at public libraries, and I think that your audience is probably aware of why that's important. If you've ever been to a public library in an urban setting anytime recently, you'll find that many individuals in the general public are there, and the general public experiences mental illness at higher rates than we often are aware of. But also Fairfax County, Virginia also has done so, and Alexandria County, Virginia has also done some training of library staff. Finally, I myself had the opportunity to train library staff here in Washington, D.C., down at our Martin Luther King Central Library. The staff of the various library branches were training in how to respond to individuals who might need help, or even individuals who are in crisis.
So tell us a little more about the action plan and the training that you use. I think you have a special way to think about it, some letters or some initials that you all use.
Sure, thank you. Mental health first aid, a lot of what we do as far as the background on mental illness, different types of what depression might look like, what anxiety might look like, what substance use disorder might look like. I use the word might very consciously because we do not teach members of the public how to diagnose or treat mental illness any more than first aid teaches individuals in the general public how to treat or diagnose physical illnesses. But we do focus a lot on what it might look like, and a lot of that stuff is nothing special. It's stuff that a lot of times some of our audience are familiar with. But what is really special and unique is the interactive nature of the course, but it's also our action plan, ALGE, A-L-G-E-E. Now the program came from Australia, thus the koala motif that you see throughout our materials. And so ALGE was the mnemonic device that came from Australia, and I'm not exactly sure the origin of algae. I think it's a pet name in Australia, but for us it's a mnemonic to remember what to do and in what order. Much like many of your audience may have taken a CPR course, and there's an acronym in CPR, a mnemonic device to help you remember what to do in what order. It used to be ABC, right? Airway, breathing, circulation. I think it's CAV now. But in our course, it's ALGE, which stands for Assess for Risk of Suicide or Harm, Listen Non-Judgmentally, Give Reassurance and Information, Encourage Appropriate Professional Help, and Encourage Self-Help and Other Support Strategies. We take this approach and apply it to various situations, various scenarios, various types of potential mental illnesses as we walk through the course. And that's really kind of the lens through which we look at this subject.
Help me think a little. I know we've all, in the last year since the Sandy Hook school shooting in Connecticut, there's been a lot of attention to the issue of mental health and mental illness and recognition and prevention, recognizing children and adults both who are in crisis. And help us think a little about how the first aid training fits into that, those bigger concerns that many of our lawmakers are talking to us about at the Council of State Governments.
Certainly, thank you for the question. It is an issue, and I think that we can go back further than Sandy Hook. We can talk about Tucson, Arizona. We can talk about Aurora, Colorado. We can talk about Virginia Tech. And all we really have to do is mention those places, those names, and everyone kind of knows what we're talking about. And so there's definitely in those communities, and we have served all those communities over the past couple of years, very specifically and in a targeted way, that a focus on early intervention. And so we've been very involved in working with those communities on the importance of early intervention. But it's also important for us to focus on the fact that individuals with mental illness in the aggregate are no more likely to be violent than the general population. It's an important point of stigma reduction in our course. Yet at the same time, we want to prepare people for how to get someone help early, because the research shows that the sooner that someone gets help for a mental health problem, the less likely they are to have a crisis in the future. And it's the same way with physical illness, right? That shouldn't surprise anyone. And so we don't promise or claim that mental health first aid will avoid future tragedies necessarily. But what we do know is that early intervention is the key to someone getting better and not getting worse.
And also, what we have seen in the states and at the federal level over the course of well over a decade now, when a tragic event like this happens, members of the community and the public policy makers that that are responsible for our safety and well-being are really thirsty for solutions. We all want to know what could have been done to prevent this. And although, as Bryon said, we are not saying that mental health first aid can prevent all acts of violence, nor are we saying that people with mental illness and addiction disorders are, a specifically violent population. We do know that looking back on some of these instances later, friends, family members, community members, neighbors were saying things like, oh, we sort of felt like something was wrong, but, we just didn't really know what to do. And mental health first aid helps fill that gap. It helps us understand how to identify when someone might be experiencing a crisis. It helps us know what resources and support are available within our community. And it helps bridge the gap between the two so that we can reach out, engage with someone that might be in crisis, help provide them with reassurance, support, and comfort, and help connect them where needed to additional professional help. And so I think that's partly why mental health first aid has been brought up so often in response to tragic events like this.
And I think because I've worked on the ground in Tucson, Arizona, and at Virginia Tech, as well as up in Connecticut with some of the foundations that have been established after the Sandy Hook tragedy. And what I see is that sometimes those tragedies galvanize communities around early intervention, but they also focus communities on healing after a tragedy or a trauma. But then the communities start to see mental health first aid or being aware of individuals with mental illness as a much broader issue in their communities. And so the effort seems to kind of focus initially on these traumatic events, but then becomes much broader and expands out and starts to touch almost every aspect of a community through faith-based organizations, through schools. Communities really start to see mental wellness as a key part of a community's health.
Okay. In thinking about that mental wellness issue, and maybe it's a little further afield from just the mental health first aid program, but I know that the National Council is involved in many segments of mental health programming. Talk to us a little about how either this program fits into or what a full mental health system in a state or a community might look like. What kinds of things should a policymaker, if in checking off a checklist of what do I have in my community, what kinds of things should we be looking for?
Yeah, I can speak to that a little bit. So I want to reiterate one thing that Bryon said, which is about early intervention. Research tells us that the amount of time that elapses between an individual's first mental health crisis and the time at which, on average, people receive treatment is 7 years. Okay, let me say that again. There is, on average, a 7-year gap between the time that someone first experiences a mental health crisis and when they receive treatment. We know, furthermore, that the duration of untreated illness is a direct factor, contributing factor, to that person's recovery or lack thereof. And the longer your illness goes untreated, the harder it can be to get back on the path to recovery. So mental health first aid, then, is a critical component both of primary prevention, which is preventing, that community wellness and resilience piece that Bryon spoke about, preventing mental health and substance use crises from occurring. It's also an important part of secondary prevention, which means identifying, when someone is experiencing that condition and helping them get the help they need so it does not progress. And so, mental health first aid, in conjunction with the community treatment resources that are available, can really help play a role in reducing that duration of untreated health needs.
Also, specifically responding to the kind of the public safety component, we do a lot of work with various agencies, and next week I'll be spending the week in Pennsylvania with the Department of Corrections up there. And mental health first aid, we see it as part of a portfolio of trainings for public safety, whether it's police or corrections. And there's a program many of your listeners, I'm sure, are familiar with called CIT, which is a training, crisis intervention training for law enforcement. Started in Memphis, Tennessee, and has spread really across the country. It's a 40-hour training. It's a week-long training. Officers in a particular department are trained in that. They're identified like a SWAT officer would be or a canine officer would be, and oftentimes dispatch will send them specifically to specific calls. We see CIT really as the gold standard for training for police to respond to individuals with mental illness. But again, mental health first aid is not as comprehensive as CIT, and we see mental health first aid for law enforcement as a complement to CIT. If a specific department, for example, has 25% of their officers certified in CIT, which is the general model, then for the other 75% of the officers, mental health first aid is a good choice, just so that every officer has some training. And then mental health first aid might be a stepping stone to the more comprehensive CIT training at some point for different officers. So that's one way that mental health first aid kind of complements other existing programs that are supported both at the local and state level. Beyond that, too, I mean, there are other programs through the various NAMIs, like Family to Family. There are different programs like for suicide prevention, like ASSIST or QPR. All of these programs we promote actively in mental health first aid, encourage people to go and get additional training, and we also encourage states and lawmakers to look at ways to support a diverse menu of trainings for people in the community.
Okay, let's move on a little to Rebecca's area, and I know she's put together, and this is of great interest to our membership, a legislator's toolkit. So now that I've listened to you talk about how important it is for a community to have a mental health first aid training program, what's in the legislator's toolkit?
Yeah, well, let me first say that I only wish I could take credit for the legislative toolkit. That was put together by our outstanding mental health first aid team, and they just did an exceptional job with it. The state legislative toolkit is designed to help folks in any state build on the efforts that have already been done at the state level to implement mental health first aid training. There really is no need to reinvent the wheel. We have many examples of successful mental health first aid legislative initiatives that others can learn from. And as Bryan so eloquently said in our little pre-webinar meeting, to hopefully improve upon the design of that wheel with each step as well. So the state legislative toolkit provides an overview of mental health first aid. What is it? Why is it important? How can it be helpful implemented at a statewide level? And then it provides all the backgrounders and information that you need to know to get a legislative initiative started in your state. It talks about coalition partners you might want to reach out to. It provides a description both of mental health first aid and the research that's been done to support it, because one thing we haven't mentioned yet is that mental health first aid is an evidence-based program with a large body of research behind it, showing both its effectiveness in helping people get the support and help they need, but also in reducing stigma, the public stigma often surrounding mental illness. So the toolkit talks about that research as well. The toolkit provides examples of different ways that your state might opt to implement mental health first aid. There's more than one way to achieve this goal. We've seen in some states that they've just passed flat-out appropriations that are to be used for mental health training. We've seen other states where they've incorporated mental health first aid into elements of other existing sort of regulations and requirements. For example, in Texas, mental health first aid is now part of the requirement for teacher training. So, there's many ways that you can support mental health first aid in your state, and the toolkit talks about those so you can decide whether, for example, in seeking an appropriation, do you want to seek a budget line item, or are you going to go for a separate standalone bill that may or may not include an appropriation of funding. Many questions here in building the policy change that the toolkit can walk you through. It also includes sample communications, talking points, media releases, one-pagers, advice on what to talk about in a public presentation on mental health first aid. And then, of course, testimonials from people that have been through the program and have experienced state efforts to get it passed, so you can learn from them as well. That's all in there. So we think this toolkit is really helpful for people who are interested in pursuing something legislatively or on the regulatory side around mental health first aid in their state.
I spoke last week with Senator Golar, Senator Esther Golar of Illinois, who had sponsored a bill to establish mental health first aid training in her state. Can you tell us some of the other states that we might look to see some models?
Yes, and this list of states is constantly evolving. We see momentum building for mental health first aid everywhere in the country. A few states, as I mentioned, you mentioned Illinois, I mentioned Texas. Arizona has enacted an appropriation for mental health first aid training. Arizona has been particularly active in the wake of the Tucson shooting of Congresswoman Gabby Giffords, as Brian mentioned. Virginia has funded mental health first aid training. Connecticut both enacted a training program, but then also calls upon school board administrators to consider how mental health first aid might be used in school settings. In Maryland, we saw a supplemental budget appropriation from the governor. I was told by my colleague Trinae Stevenson just yesterday that Colorado has introduced a funding request. So, states are now embarking on their legislative sessions, and and Alaska. I almost forgot to mention Alaska, where, as many of you probably know, there's a particularly high prevalence of suicide, and mental health first aid is especially helpful in engaging with people in the midst of a crisis, such as thoughts of suicide. And so they have introduced legislation up there as well. And I'll also point out that Alaska Senator Mark Baggett has been a huge champion of ours in Congress. There are many states taking action, and we're more than happy to provide, if folks have questions for us about what the different states are doing, they can certainly reach out. We're happy to provide updates.
Okay.
And another thing I think of interest, and I'm sure we'll get there eventually, is where there's already vibrant mental health first aid activity in your state. I think some of your listeners might be surprised to learn that their states might already be very active. And in some ways, we really encourage your Mental Health First Aid USA tapping in and leveraging existing resources. I think that's one of the things that the toolkit will encourage, is utilizing those existing resources, and that's great for those you serve in your state, and it's also a good way for us to help sustain our instructors around the country.
When I was talking with the senator from Illinois, one of the things that she pointed out to me, and I think you've said it before, but I'm going to give you an opportunity to sort of take off a little more on it, is how important the training can be for lay people as well. And the example she gave to me that she said she thought was important is, she said that she hoped that in neighborhoods, if someone sees a neighbor acting, and this was her word, peculiar, that instead of ignoring them, they might respond. Can you tell me a little more about that, and I think about your all's goal around reducing the stigma of mental health?
Well, certainly stigma is often a barrier to individuals reaching out. And that's actually one of the interesting components of some of the outcomes research that's been done about mental health first aid, is that it does reduce that physical distance that people want to put between them and someone they perceive as having a mental health problem. And so reducing that stigma is really a key part of what we do. And the idea is that, individuals in our community will experience mental illness. 1 in 4 Americans in any given year will experience a mental illness or substance use disorder. And so the more people there are in the community, the more likely that someone close by early on will be there to help. We have scores and scores and scores and scores of anecdotal examples. You can see them on our website, mentalhealthfirstaid.org. They scroll by with pictures and testimonials of people who've utilized the course. And so although we talk a lot sometimes about teachers and police officers and pastors, really oftentimes it's husbands, wives, sisters, brothers, mothers, fathers, neighbors who provide mental health first aid to those closest to them.
And I would add to what Bryan said, mental illness is still in many ways hidden in the shadows, and it's not a condition that we talk about in the same way that we might talk about cancer or diabetes or lung disease. For example, my sister bought me a shirt that says in giant letters, "Cancer sucks." And I wear that t-shirt all over town, and every time someone sees me in it, they want to talk about cancer and how much it sucks, because it does. I have another t-shirt that says, "Stomp out mental illness." It was for a 5K race that a colleague of mine ran. And when I wear that t-shirt, people don't stop and want to talk about mental illness. And so, I think that when you go through the mental health first aid training, one of the things you learn is how surprisingly prevalent mental health and addiction conditions really are. And I think a lot of people have in their head this kind of scary, exaggerated vision of some, escapee from a mental institution that's wreaking havoc on the streets. But of course, that's not the main face of mental illness. Depression and anxiety are far more common. And these can be mild conditions or severe conditions. And we all know somebody with a mental health or substance use condition. We all do. Even if you don't know, you know them. You know them. And that's one of the things that you learn from mental health first aid. And so I would say, and as our CEO, Linda Rosenberg, has said, mental health is the last illness that people talk about in whispers. And mental health first aid allows us to talk about it, out loud. And bring clarity and understanding to this issue.
One of our big audacious goals is that mental health first aid will be as ubiquitous as regular first aid someday. And the reason for that is because mental illness is as common as physical illness. Yeah. We wouldn't dream of not preparing ourselves for a potential physical problem. So we're really encouraging people to add mental health first aid to their community awareness, their community response toolkit.
I really appreciate what you've said, and you're right. We all know someone who's impacted by this, and you're talking to a woman whose father-in-law had serious mental illness, and whose husband grew up in a family where that was a part of their everyday reality, and so it's out there. It's not necessarily something that everybody talks about. We'd probably be more likely to talk about your husband's mother who died of cancer than your husband's father who had schizophrenia, but it happens a lot, and so I think what you all are doing is really very important. We appreciate you joining with us today.
And just to add to, thank you for sharing that. I think that every time we feel comfortable enough sharing stories like that, it helps us to reduce that stigma. We see it every day in the work that Rebecca and I do. But also I want to emphasize that the mental health first aid curricula is really strength-based. It's really recovery-focused. We're really focused on how people can get help and get better and live, the life that they want to live. I should also note that our curriculum is we're very much involved with organizations like DVSA, the Depression Bipolar Support Alliance, and NAMI, National Alliance on Mental Illness, when developing the curriculum, and ongoing, at least 20% of our instructors nationwide are open and out about their lived experience with mental illness. And so that's really important because in the consumer movement, individuals who consume mental health services, there's a concept of nothing about us without us, right? And so the individuals who experience mental illness or have lived experience are an important constituency in the work that we do and intimately involved in everything that we do.
Very much. Do you have any other last tidbits to add? We will be posting this on our session. Do you want to maybe share with us a little about the federal activity that's going on in Congress?
Sure, I can talk about that. Yeah, absolutely. So at the federal level, we've seen a lot of action on mental health first aid over the last 2 years. We were really pleased in the 2014 budget that Congress passed just last month. We were really pleased to see an appropriation of $15 million for mental health first aid training grants. That was part of the President's Now is the Time initiative, which came about, of course, as you all know, in the wake of the Newtown shooting. But it's part of his sort of comprehensive effort over the coming years to increase mental health literacy among the public. The President again requested $15 million for mental health first aid in his 2015 budget request. We also have the Mental Health First Aid Act, which is a bipartisan bill introduced in both houses of Congress with very strong support from Democrats and Republicans alike. That bill would allocate $20 million for mental health first aid trainings around the country. One of the most exciting developments that we saw at the federal level last year was during all of the debate over gun violence, which we could have another hour-long conversation about whether or not it's appropriate for something like mental health first aid to be attached to a gun violence bill. But leaving all that aside, it was voted on as an amendment to the gun violence bill. And that is part of a package, by the way, with a whole bunch of other mental health interventions, Garrett Lee Smith's suicide prevention activities, and much more. That mental health package was approved as an amendment to the gun violence bill by a vote of 95-2 in the Senate. Now, as one of my colleagues likes to say, you can't even get 95 senators to vote on a resolution in favor of Mother's Day. So we feel that was just a really thrilling success for mental health first aid. Of course, the gun violence bill was then tabled, and so that mental health component didn't go anywhere legislatively. But we do have a number of champions and really devoted and committed legislators in the House and Senate that have been working really hard to promote mental health first aid. And you can see our 4 key champions on the screen, but I just want to reiterate that it's been a bipartisan effort, and we expect to continue advocating for more resources for mental health first aid at the federal level in coming years.
So if there was an appropriation in 2014 and there are going to be grants, one of the things that I could do as a state legislator is to contact my Department of Mental Health and ask if they're going to be applying for that, any of that grant funding. Is that sort of how our members can be advocates for this program?
Sure. So we are still, because the 2014 budget, despite the fact that we are some number of months into the 2014 fiscal year, because the 2014 budget was only just passed last month, we don't have any guidance yet from SAMHSA on how the funding will be dispersed. It is my understanding that due to a quirk in the legislative language, that the money for the first year will be administered through educational agencies. So again, though, we have no details on this yet. We're still waiting for guidance from SAMHSA. And in the President's budget request for 2015, he explicitly said that the mental health first aid funding in 2015 and beyond will be used to support training for a broad variety of stakeholders, not just educational audiences. So we're waiting for more details there.
Okay, so that still gives our members an idea of who to begin to talk to so that this opportunity doesn't pass by a particular state. So we thank you very much for that. And I think we're going to wrap up now. As I've told, as I said at the beginning, for those who are listening to the webinar with us today, we will be posting the webinar on our Knowledge Center, and you will receive an email telling you about that. And then we share that we hope that you will share that site and citation with other colleagues of yours. And we certainly thank Rebecca and Bryan for joining us today. And I'm sure they're willing to speak or take emails from you if you're interested in their programs and beginning an effort around mental health first aid in your own state or community. So thank you very much. Thank you, Bryan. Thank you, Rebecca.
Thanks.
Thank you.